Hi, I'm Dr. Roger Moore, here to answer the question, what should I look for if I'm concerned about skin cancer? This is a great question. It's important because skin cancer can be important for any of us. If you have a new or changing growth or lesion, or you have a sore that just won't heal or bleeds, you need to have it looked at and evaluated. The three most common skin cancers are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Now there are other types of skin cancers as well, but these are the three most common that we see frequently. The basal cell carcinoma and squamous cell carcinoma are termed non-melanoma skin cancers. These type of skin cancers are often found on sun-exposed sites, and there's something that happens with more advanced age, but they can happen at any age, so you have to be aware of that and know that they often start off as just a small bump. Now, malignant melanoma is actually something that can be related to sun-exposed sites, but it does not always occur on sun-exposed sites. In fact, the number one site for men is the back. The number one site for women is the back of the lower extremity, so on your leg or thigh. You have to be aware that you need to be looking for spots everywhere. Now, the basal cell carcinoma is actually the most common skin cancer. It's usually on sun-exposed sites. It will present itself as a pink or red bump that's often raised, and sometimes a sore that won't heal. So if you get a new bump that looks pearly, waxy, or glass-like, you have to at least consider the basal cell carcinoma, especially on sun-exposed sites, including the face, the ears, the nose, and the upper extremities. Sometimes it just looks like a little bump, maybe even an acne bump that won't go away. That should be one of your warning signs for the basal cell carcinoma. So you have to be aware that any new or changing bump or a sore that won't heal is important. But even the sores start out as often a pink raised bump. So if you learn to diagnose things, or at least come get them checked out when they're just in the bump phase, you can actually head off some of these skin cancers before they become much of a sore. It's that sore stage that you know something's abnormal. If we can catch it before then, you're often ahead of the curve and improving your chances of a positive outcome. Now, some people will get an acne-like bump. When you get an acne-like bump and it doesn't go away, or you really are not someone who gets many acne-like bumps, if it stays for more than a few weeks or month, you have to at least consider the basal cell carcinoma. And sometimes you actually get more brown bumps or raised areas that can occur. And if they're new and they're there for more than a month or two, you should come and get it looked at, because basal cell carcinoma can look brown. It can even look like a rash at times. It's interesting that a rash that won't go away and is fixed, doesn't come and go, can be a superficial basal cell carcinoma. So if you have something like that and you've already tried maybe a topical cream, come on in and let us look at it. Sometimes it can be a skin cancer. It'd be important to catch it early. Even on non-sun exposed sites, skin cancer can occur. Basal cell carcinoma has been reported, and we find it and diagnose it here, like this one, on areas that you normally wouldn't see the sun shining. So you have to be aware of that. Now, for squamous cell carcinoma, it's the second most common type of skin cancer. It generally arises on more sun-exposed sites, and it can be tender or painful as a raised bump, often a little bit more raised and sometimes even more inflamed than what you would find with a basal cell carcinoma. It is something that can be misdiagnosed as a cyst, a wen, or just an inflamed hair follicle. But you have to be aware that these raised bumps with squamous cell carcinoma are fixed and they won't go away. Sometimes they'll have a central crust or keratotic or rough center to them. If you have something like that, make sure you get it checked out. It's important to understand that if you have a new or changing growth, or one that simply won't go away after a month, come on in and let us look, because it's important to check these spots and make sure that you're getting it evaluated, especially if it bleeds or it's concerning to you. Now, malignant melanoma is actually something that can be life-threatening and can have a poor prognosis if it's not caught early. Many of the melanomas, though, start off as a dark brown or black type of mole that can be new or changing. When you want to look at malignant melanoma type lesions, you want to think about the A, B, C, D, and E's of melanoma. This kind of acronym or mnemonic helps us remember that if you have a new mole that is changing and has any type of features to it that don't look normal, you should have it looked at and evaluated. A sore that won't heal, a dark mole, or one that is somewhat asymmetric or irregular, come on in and let it be evaluated by a professional. And the images we're showing in this slideshow are simply samples. If you have a growth that's been there for more than a month and you're not sure what it is, come on in and let us take a look, because it's important for us to make sure that we're on the right track. It's also important to know that an annual dermatologic skin cancer screening exam can be life-saving. We diagnose many people with skin cancer who didn't even know they had it, simply because they're taking care of their health and taking responsibility for themselves by coming on in for that annual exam. So make sure you're part of that group. The more you care for yourself and the more that you take care and educate yourself and are diligent about your skin cancer screening exams, the better chances you'll have of having a positive outcome in reducing your risk of having skin cancer or catching it early.